Hello and welcome to the Bill and Kelly Show. With us today, we have a second time guest, Lori Postma, who's with the Northwest Indiana District 1 Emergency Operations Center. Welcome back, Lori. We're so happy you could come back on the show and talk about the neat news that just happened.
Thank you. We're happy to be here.
I saw it all roll across this weekend, and this exciting news about, it's exciting but much needed news. I mean, the excitement is in the feeling good that these hospitals are going to get some much needed equipment. So we saw the news about the ventilators, and everyone has been talking about the shortage of the ventilators, and as we were saying, every hospital is different. Some are in good supply, and some are not. So talk to us a bit about the ventilators and where they came from and how many you received.
What was pretty exciting, we actually were the benefactor of Peter Navarro at the White House. He has been very helpful in trying to help out Northwest Indiana, knowing that we're a hot spot here. And so he has really, his group has been very beneficial in helping us out, and we're grateful for that. GM was converted into a ventilator making over at the Kokomo plant, and Ventec is the ventilator maker, and they were creating them there at the Kokomo GM plant. And so between them and uh, UPS that delivered them, with our group here at NISA, we were able to receive those on behalf of all 17 hospitals, and each hospital is going to get two of them. And that's
Awesome.
pretty awesome.
Yeah, it is. It is. It's scary stuff out there. The frontline workers, you've got to, and you guys do a great job there, but to be in that position and and see what they go through, and their main concern is to save lives and maintain health for people, and not having the equipment has got to be scary. And so this is a godsend that everyone should appreciate. And now going back here, this is actually a pre-design. The design of this ventilator existed before. It was the manufacturer using the GM plant to produce them. Is that correct?
Yes, I think that these ones are a little bit different than their standard ventilator. They're meant to be used for disaster necessities.
Hmm.
They are a really nice design, very simple to use, easy to fire up. And as a nurse, they talked me right through it, and it was pretty simple to use. So that'll be real helpful on these big cases that we have going on.
Yeah, and I saw the picture of them, and I mean, they're, of course, I'm not that familiar. It's been ages since I've seen one, but they're pretty small. They're like a little
Yeah,
suitcase. And the ones I
yep.
remember back 20 years ago were like a big box, like
We still
a
have those too.
refrigerator.
Yeah.
So, oh boy. And so these are going to be, because one of the scary things about the coronavirus is the way it attacks the lungs and the respiratory system, to where they just can't breathe on their own. And so that's why a lot of these people that are critical, that where the lungs are under attack by the own body, the self defense mechanism, they just can't do it. So these ventilators are actually going to be able to provide the volume that they normally wouldn't have. So that's amazing. So
It sure.
yeah, so those got in, and you tell me that some went right out to Michigan City. I take it they really needed some, so that was
Yep.
great.
Well, they're preparing for what they might have coming their way, and we're seeing it in the news, and everybody. Our numbers keep rising.
Hmm.
There are a lot of places in the state where they have plenty of ventilators, and that's how the difference in the numbers that you see, that we're only using 75% of the ventilators in the state of Indiana. Well, 75% of the state of Indiana is having minimal cases, and there's just some key places that are hot spots that are getting a lot of patients and are needing this kind of equipment. We do share amongst each other. It doesn't matter what brand of hospital it is. If we have it and we're not using it, we're happy to give it to even a competitive hospital. But this will be helpful for everybody to have a couple. And I can tell you, we can loan them back and forth to each other as needed, and that'll be really nice.
So, District 1, the hospitals you cover geographically, that's LaPorte, Porter County, Lake, and
Newton and Jasper.
Newton and Jasper. So,
Yep.
the hospitals in those areas, you try to keep a pulse on and what they need as far as emergency supplies, masks, and ventilators, and do your best to keep them supplied.
Yeah, it's been a great partnership. We're one of the private partners of the NISA group, the Northwest Indiana Information Sharing and Security Alliance.
Oh,
That's a mouthful.
all these acronyms.
Yeah, we're big in the acronyms. So NISA is the group that helped bring this EOC together and help create the MAC environment, a multi-agency coordination center, so that we can have one place to be able to filter out some of these requests for things that maybe the state doesn't have, or everybody has a shortage of all this stuff. So if
Right.
we can create one place that we can accept and dole out to help out everybody, that's what we're doing.
Yeah, and that's sorely needed in this time. Yeah, because there's not anything like you out there. So, and that's something I didn't realize that you're a private group. So,
Well, we're public private. It's a partnership. It's kind of
okay,
nice.
all right,
Um, I work at one of the hospital chains, and so, but it doesn't matter because we all have emergency preparedness people, and we get together monthly. And right now, of course, we're not. We're getting together virtually, but that is our time to prepare for the upcoming disasters. We all practice together. We all do training together. We do drills. We do big exercises together. So this isn't like a new partnership. It is something we've been doing for a long time, and NISA has been around since 2008, since the floods.
hmm,
And so at that time, it was kind of created through Dave Kapp, the U.S. State's attorney. He kind of realized that we needed to have this coordination ability, and the hospitals just sort of joined in with them. And it has been a great partnership because sometimes you can't go the route of your regular distributors,
right,
which has been the case because the supply chain has been broken
hmm,
because it's going everywhere. And so utilizing our NISA partners with the private industry got us through in a big way. Certainly at the beginning, before we even got any of the strategic national supply, we had our industry partners that were right there for us, and we were able to utilize some of their N95s that they had, which are, of course, like the oh so important masks that we really truly need.
right. And so let's get into the other supplies, the ventilators. I mean, that's one thing, and hopefully we'll get more, right? I mean, maybe we'll get some more down the road.
Hopefully we won't need more. That would be great. That would be better.
Right. So let's get in the other supplies, the masks. Everyone talks about the masks, the N95s, and these are the masks that are really high efficiency filter masks. And there's some out there, but one of the things that I hear constantly from nurses, nurse practitioners, and doctors is they're reusing them. I mean, and that's not
We
really
are.
necessarily
Mhm.
good, right?
Well, absolutely not. I mean, normally we wouldn't have ever needed to reuse them. So this is new ground for all of us.
Hmm.
We have found a way to reprocess them. Several hospitals in the area are using UV light to be able to sterilize them again, and we we are all going outside the box to figure it out.
Yeah.
That's for sure.
Well, some amazing things have already happened. A GM plant was repartitioned to manufacture
They've done
ventilators,
that.
and
Yeah.
so American ingenuity. It always it never fails us, and that's what I think people ought to realize is America is great. They come together in a time of need, and people get things done that are remarkable.
They
So
figure it out.
yeah, we get it done, figure it out. So let's talk about some of the other things you maybe need. the N95s definitely, and I heard
Yeah.
so many calls out to companies that look at their look at their storage facilities, make sure there aren't any tucked away in a corner, and get them to you guys, and you distribute them from there. And there are other needs other than that, though, right? I mean,
Yep.
besides masks.
Surgical masks, which are like a flat mask, those
Mm-hmm.
are really important. And homemade masks. We have every day we get requests for from nursing homes and hospitals and all of these type of care facilities that are in desperate need of those homemade masks.
Right.
We just don't have enough of the other kind, and being able to utilize these for not necessarily the frontline staff. The frontline staff is who we want to save those important N95s for. We want to make sure that we're protecting the people in the hospitals who deliver the food trays and who are cleaning here, there, and everywhere. There's a lot of people in the hospitals who need those masks that aren't necessarily the nurse taking care of that patient.
Yeah, and when it comes down to it, even though N95s are, you've got to have them if you are coming direct physical contact with the patient, but something is better than nothing. Am I correct? I
Correct.
mean, if
Correct.
we run out of N95s, you have to be protected some way. So I see a lot of people making these at home now, and in fact, I think I shared this with you, and our fans are sick of me showing this, but we do
I
have.
love that. I think that's awesome. I'm a
I,
fireman and a nurse, and I had a really great lady is out there making me ones that have flames on it, and I'm kind of a little bit
awesome.
proud out of it.
Yeah, I'd like to have
I'll have
that.
to show you that when
Yeah,
I find.
yeah. Well, we may, you never know, we may get you a Bill and Kelly show mask.
I'm I'd
So
wear it. That's pretty awesome.
yeah, it is. It is. I like it. And so yeah. So if they want to donate, if they have something that they have to donate, like a homemade, and there's a lot of people out there that are making them at home. Um, we talked about this before. There's a number that they can call to contact you if they have some masks or other material to donate.
Absolutely. And if you give me a minute, I will make sure I get that for
Oh,
you.
no, no problem.
I
Take
didn't
your
have it
time.
right in front of
Hey,
me.
listen,
Um,
this is the Bill and Kelly show. Stuff happens like you wouldn't believe. We have train wrecks you wouldn't believe. We're relaxed. We're not uptight that way. So take your time
Well,
and get
we've
it.
got some real hardworking people here who are in the background who are now scrambling for that number, and that's good. So we'll have it for you in just a minute.
Yeah. Okay. So
But
we'll get the number to you, but they could also contact you through your Facebook page
they can. Yep.
and
Our District 1 COVID info is our Facebook page. We have it on Twitter. And we also have, we're out here at the Gary Airport, and things could be dropped off here, or we can hook up with a phone number and we'll come and pick them up from you.
okay. All
Our
right.
phone number here is 219-576-2786.
2786, and anyone that answers the phone, right? Or
Yep.
all right.
You can just tell them you got a donation, and we'll arrange for a pickup.
Except if they're a Packer fan, we don't talk to Packer fans.
Well, it was the Packer fan that got me the phone number, so right now he's okay.
Okay, well, sometimes you have to be a little slow with them, make sure they understand
Oh,
fully.
I know.
So moving on. So gowns. Now, I mean, that's something. I mean, do people make those at home? I
You
mean,
know, we've had people making them at home, and that's really nice too. That takes a lot of fabric, and it's a little more of a commitment.
mm-hmm.
But we are definitely utilizing some different kinds of materials, et cetera, to get these. I know we've been looking into some ones that are made locally out of like Tyvek material, and Tradewinds has been out of Maryville has
Yeah.
been making some of those, and so we're hoping to figure some of that out too.
What about those booty things that they put on? I mean, is that something there's a need for, or
Like foot covers,
yeah, foot
etc.
covers. All right.
There are some hospitals that are requesting those. We don't have a lot of call for those.
Okay.
Generally, it's sort of whatever's in front of you. Like face shields are important.
Right.
look here, I've got one of the homemade masks here. These are
Oh,
kind of cool.
well, I do have a plaid mask too.
Yeah,
So
we've
yeah,
we've got some really
yeah,
fun ones.
yeah.
We've had some really nice donations that have come out, and we have hospitals have just been thrilled to get them, as well as nursing homes.
And again, these masks. So if you're sitting out there thinking, "Well, I don't have N95s. I'm just making for general population," you need anything that so you can put it in the hands of people that serve food, ancillary crew that
Yep,
help back
absolutely.
up the primary crew,
Yep,
custodians. I mean, everyone that
yep.
works within the vicinity of those patients needs to be protected. And at this point, and I've
People
read.
who deliver supplies to the floors.
Hmm.
We want everybody to be protected, and this is the best way to do that.
Yeah. And, I really do think I've shared this on our show several times is that I think unless the numbers start going down, which they've showed some promise, I saw the numbers level off for Lake County, which shows some promise. Um, I really do think that we're going to be required to wear face masks outside anywhere where we go in public areas. But we got to remember they need them at the hospitals first. And
You you know it. There's nothing wrong with wearing a mask out in public, and no one should feel bad about doing so. It's actually a sign that you are keeping the faith and doing the best you can for everybody around you as well as yourself.
yeah.
Now, I will say about those numbers leveling out, we always have a dip over the weekend
Hmm.
because I'm not really sure that there's as many people working at the state level on the weekend as
Okay.
there are during the week. So it'll be interesting to see in the next couple of days if our numbers continue to rise,
Well,
which
thank you for
we,
pointing that out. That's something I didn't
someday will
realize.
rise.
Yeah. What I do is look at the percentage of infected versus tested, and that gives you kind of a window of what's
Yeah.
happening. And for the first time, I saw Lake County at like 15% out of the new numbers. And they have been riding in general since this has started about 20. Well, just recently they climbed to 22% because of the rise. But yeah, and that's one thing that as I'm talking to a pro here, so to speak, and you are a pro, so to speak. Sorry, but no. All kidding aside, is that one thing that when you go out in public, particularly in a mixed area, it is better than nothing. And I was looking. In fact, I did a thing on our show showing how effective face masks are. Even the cloth that you get from a T-shirt, if you fold it 3 times and use the rubber bands, what they show you how on the CDC, actually the Surgeon General is showing people how to do it. That is effective. I mean, 75% effective. And they're not as good as the N95s, but at some point, anything that stops a droplet from you breathing in a droplet is good, and from you breathing out. So
And also from you touching your face, because anything that gets on your hands gets into your mouth, your nose, your eyes, etc. By having that mask on, it keeps you from harming yourself with whatever might be on your hands, and so that's why masks are even a little bit better.
that's very true. That's very true. Yeah, and talking about that, there's another supply thing. How? What about gloves? Because I know we can't find any gloves out here anywhere. How are you looking for gloves? I assume as well.
We do have some gloves available, and hospitals are able to get some of those. We haven't had a huge run on them, but they definitely are needed. Uh, but I think we're inching along with those. They're not nearly our biggest concerns are the masks and gowns. Those are
Hmm.
the two things that we just can't keep enough of.
Okay,
Face
so
shields are right behind that,
yeah,
and that's like the plexiglass or the covering over your face, some sort of thing that can be reprocessed or cleaned and used again is always great.
yeah, and I see that there's a organization out that's supplying parts to people that are willing to make them at home. So there's that too, and I think in our next show I'm going to provide information on how to get a hold of that company because, a lot of us are sitting home, and
Yeah.
binging Netflix is not necessarily a healthy thing to do. Well, it depends what you're watching, I guess. But it's hey, you might as well be productive, and you know, you can only.
I wouldn't mind a day to get my laundry done personally, but until this is over, I think that it'll be, slim to that.
Yeah, yeah. I mean, you guys are in the hot seat there. I mean, you're on it. So, and that's the other thing. I do want to say thank you for everything you guys do out there. It is to know that there's someone out there monitoring things and needs of the different hospitals and making sure people know that hey, we need masks and then once you get them, make sure they get to the right place. So that is great. Before we wrap up here, is there anything else you want to share with us? One thing I do want to ask you before we go, what is it like working there? I mean, I understand there's a Packers fan amongst you, and it's got to be difficult. But outside that, and I realize social distancing with the Packers fan, you double the distance, right? 16,
Yes,
yeah, you
totally.
12 feet at least, right? Okay, so given that, no, no, just what is it like being there? I mean,
Well, I have to say that we have the best staff here. And I know people say those things, but I really mean it. We have people who want to be here. They are volunteering their time. If their entity didn't send them here, they are here on their own accord, not getting paid, not having any of that sort of thing. NISA doesn't come with a paycheck, it is a volunteer organization. And so we are all glad to be here. Everybody comes on their own. Nobody has to show up, but they all do.
hmm,
And they come with a smile on their face and they're happy to help.
yeah,
I have more people saying, "What do you need me to do next?"
hmm,
That makes that makes my heart happy, I must admit. I had a man today who was here as a volunteer and he said, "I delivered life-saving ventilators to a hospital today." He said, and I've never gotten to do that before. And
wow,
that's it means a
yeah.
lot. It means a lot to help people. If you can't help people any other way and this is the best way, my goodness, what a great way to do that.
So you need people to deliver things. So once you get them,
Well, right now we got kind of a good staff now,
hmm,
but early on we were a little concerned,
okay,
but we've been able to handle it so far.
all right, good.
We have firemen and we have policemen and we have retired firemen and policemen
Hmm.
and emergency managers and we have people from industry, and that's what NIST is all about. It's that public-private partnership getting together, and it doesn't matter where you belong. You just all belong together,
Yeah.
and we've been very happy to have this great group working together.
Well, that sounds great. That really does. And cooperation in this time is really essential. It is, and well, it's great to know that you guys are getting along there and moving
even
along. And
even my cheesehead fan, him and I have deployed on numerous uh, tornadoes and hurricanes and out of state and Florida and New York and all of those places, and we generally end up working like a well-oiled machine,
there you go.
except during football
When it
season.
comes time to serving the people, all the whether you're a Bears, Packers fan, or God forsaken Sox fan, you just put that away, right?
I won't even take that personally.
Please don't,
I
please
prefer
don't.
to think of myself as a Blackhawks fan
You got
because
to look at
they're,
a
they're
Cubs fan. Really, we're always it always is a sign
you
of
are
hope.
faithful.
Yeah,
No
we're
matter how
faithful.
bad your team is, you're always faithful.
Exactly, exactly. Well, Lori, I can't tell you how much we appreciate you coming on and sharing what you guys are doing, what you need, specifically the good news about the ventilators. And I know it's old news right now, but there's some actually we have some international fans that are tuning in right now that are kind of interested in finding out what's going on here. So thank you so much. Thank you for what you do, and please, anytime you guys need something, feel free to reach out to us and we'll let people know what you need and see what we can do.
Well, thank you very much. And we appreciate you out there helping keep people informed in the right news
Hmm.
versus, what they could possibly be hearing otherwise. So
No,
my last words are tell everybody to wash their hands and stay 6 feet apart still.
exactly, exactly. And if you're going out, if you got a face mask, and I always tell people, if don't use the excuse that you can't find a face mask, go to the CDC, YouTube, Facebook page, and the Surgeon General himself will show you how to make a mask. So, and it's something to put over your face. So,
Yeah,
um,
there's people cutting apart t-shirts and using those as wraps. So
mm,
there you can always find something.
right. And something is better than nothing. That's what I'll say. So, well, listen, Lori, we appreciate this so much, and you have a great day, and we appreciate so much what you guys are doing for us out there. All right?
Absolutely. Have a great day.
Oh, you too. You take it easy. Bye. Oh, a phone call coming in. So, well, listen, I got to repeat that since my ringer overshadowed that. But listen, we appreciate everything you do. Have a great day and stay safe out there. And we'll say goodbye for now.
Bye-bye.
We'll see you, Lori. Take it easy.
This episode of The Bill and Callie Show is brought to you by Tiger Plumbing. Whether you need to replace a faucet, overhaul your sump pump, or desludge your drains, call Tiger Plumbing. In today's world, knowing who's at your door is important. Tiger Plumbing sends you your technician's photo, estimated time of arrival, and a little bit about him or her. Hey, Sam likes fishing and camping. Cool.